For more on the rising numbers of out-of-school children in the Northeast, let's speak with UNICEF Chief Field Officer in Maiduguri, Phoung Nguyen. Thank you for joining us on TVC News at 7. So UNICEF's collaboration with government in this regard has been on for a while. How much progress would you say we are making? And would you say that we're meeting the set targets as well?
Thank you very much for having me. And indeed, we have made tremendous progress since 2018, where we piloted a number of strong initiatives, such as right to learn and Kanuri arithmetic and reading interventions. Some of these programs have proven incredibly effective in teaching children foundational literacy and numeracy skills. And we are now experiencing really very strong success. So for example, we have Fatima, a 10-year-old from a primary school who had to stay back and could not get promoted. Since we started a program in her school that teach children foundational literacy and numeracy skills, she and 9 other children were able to be promoted this year moving forward. So we have the right tools, we know the right programs, and we have qualified teachers. We also had trained over 1,200 teachers last year. So we're qualifying teachers. We have programs in place, and now is the time for us to scale this. And we do this together with the government of Borno, of Yobe, and Adamawa, and of course, with the support of our development partners and local communities, as well as NGOs.
In all your years of advocacy in this regard, Ms. Phoung, what have you identified as the biggest challenge, to getting back our children to school, and what do you think stakeholders must begin to do differently?
Yes, poverty is really the underlying problem, and of course, compounded by the protracted conflict and displacement. So this is, and then on top of that, also lack of economic opportunities. All of these are drivers to keeping children out of school, and even for those who are in school, to pull them out of school. And so what we need is good quality education to keep these children to school, to attract them to school, and to allow the parents and caregivers, giving them the opportunity to remain in school. We have a problem right now. It is a learning crisis, whereby 3 out of 4 children are unable to read a basic sentence even after 6 years of education. So we have the programs in place, and we know that it works. Now is the time to really invest. UNICEF will not leave these children behind, and we work very closely with the government to make sure that the investments are put in place, and we work with our development partners on the same. So we have those magic bullets that we know have proven to work. Now we just need to really scale it up, because 1.6 million children out of school is not a good number.
Absolutely, I agree with you, and we have to bring that number down, hopefully in a very short period of time. Phoung Nguyen, UNICEF Chief Field Officer in Maiduguri, thank you for all the work you're doing.
Thank you very much.
Package now as to what the Nigeria Medical Association is doing, setting up an independent investigative body to investigate the death of the female medical officer.
An unusual scene of house officers on Broad Street in Marina, Lagos. They trooped out on Wednesday morning to demand the full investigation of the death of one of their own. Dr. Vuare Diaso, a medical officer undertaking a housemanship at the Lagos State General Hospital, or DON, Lagos Island, died on Tuesday, the 1st of August, 2023. She passed on as a result of the mechanical failure of an elevator at the hospital. Everything seems relatively normal at the doctor's quarters, scene of the incident. The now cordoned-off faulty elevator still bears no precaution guide. With the elevator out of use, house officers now have to use the stairway down the 10-story building. House officers who are doctors residing in the quarters tell TVC how they are exploited and neglected in the sector where they are expected to save lives.
There was no one here to help us. With 24-year-old, smart, intelligent practitioner like her, who has a lot to offer this country as a whole, it is sad to lose her this way. And the fact that she suffered so much, she had her legs fractured, multiple facial injuries. The glass in the elevator was in her skull. In her skull, they broke a lot of part of her face. It was a gruesome sight, and of course, had all of us in our tears. But notwithstanding, we demand for justice.
Her death brings to the fore decade-long complaints and poor review of hazard allowances of medical personnel.
Our colleague that we just lost, may her soul rest in peace, she was supposed to attend to about maybe 6,000 patients in her lifetime. Those are the people losing out. The citizens of this country are the people losing out.
At the General Hospital, all the administrative officials are nowhere to be found. According to security officials at the gate, their offices are locked.
We're going to audit all the general hospitals going forward. NMA will do that. It's not business as usual. Everybody involved in killing of our doctor will pay for it dearly. There must be justice, and it's not just justice seen, justice must be served.
Meanwhile, the Lagos State government has commiserated with the family of Dr. Vuare Diaso.
The indefinite strike declared by the Nigerian Medical Association means that house officers will down tools at 3 general hospitals on Lagos Island. Medical community is grieving, and they've taken a resolute stand to investigate and hold to account those responsible for the death of Dr. Diaso Vuare. Sarah Ayeku, TVC News, Lagos.